Have you ever woken up with the feeling that your body is moving with the handbrake on? The mirror starts telling a silent story: dull skin, lifeless hair, swelling you swear wasn't there last month. If this sounds familiar, it may not be just age or stress, it could be hypothyroidism. Today, I'll guide you through 17 visible or semi-visible signals your body sends when the thyroid slows down. Not to alarm you, but to give you clarity. By the end, you'll have a clear checklist to discuss with your doctor and take the next step safely. The thyroid is a small gland at the base of your neck, but its impact is enormous. It regulates metabolic rhythm, body temperature, skin, hair, nails, digestion, mood, and even how you store energy. When the thyroid goes into economy mode, the whole body tries to adapt. And it's during this adaptation that external signs show up. Let's go step by step, from the neck to your fingertips, in simple, practical language. 1. Goiter, the neck that speaks. Try a 20-second test. In front of the mirror, with a glass of water, tilt your head slightly back, swallow, and watch just above the collarbone. The thyroid should move up and down discreetly. If you notice enlargement or an unusual bulge, it could be a goiter. Not all goiters hurt, sometimes it's just a mark that the gland is being pushed to produce more hormone than it can. Red flag? Yes. Panic? No. It's a reason to schedule a medical evaluation. 2. Dry skin that doesn't improve with moisturizer. A good cream fixes almost everything, except when the problem is internal. With a slow thyroid, the skin loses natural oil and water, becoming rough, dull, with that ashy look no foundation can hide. Moisturizers may help for a few hours, but the dryness always comes back, and over time, small cracks appear. 3. Cracked pavement, steatotic eczema. If, besides dryness, you see fine intersecting lines forming a mosaic, especially on your legs, it has a name: eczema due to lack of skin lipids. It's your skin barrier crying out for help. When metabolism slows down, the skin produces less cement between cells and the mosaic appears. 4. Thick patches on hands and feet. In some cases, the skin on palms and soles thickens, hardens, almost like an armor. This is excess keratin, the same protein that strengthens skin and nails. The good news: once hormone function is corrected, these plaques usually regress. Don't wait it out alone, document with photos and take them to your doctor. 5. Firm swelling around the eyes, and a puffy face, those under-eye bags that feel like padding? In hypothyroidism, swelling is often firm to the touch. It's not just water, it's the buildup of gel-like substances in the tissue, known as myxedema. It often starts in the eyelids, giving a tired look, and later shows in the hands and ankles. 6. Enlarged tongue, swollen calves, the padded body. When myxedema progresses, the tongue may look bigger, making it harder to fit comfortably in the mouth, and calves appear full. But this hypertrophy isn't muscle, it's infiltration. The good news: it usually reverses with the right treatment. 7. Diffuse, persistent hair loss. If your shower drain is filling up and old photos reveal the volume you've lost, take note. In hypothyroidism, more hairs enter the resting phase prematurely and fall at the same time. The result is overall thinning, dull, brittle strands. Unlike androgenetic alopecia, which creates receding temples and thinning at the crown, here the impression is of hair deflating all over. 8. Queen and sign, thinning outer eyebrows. Ever noticed missing hairs in the outer third of someone's eyebrows? That's a classic, subtle sign linked to hypothyroidism. It doesn't hurt, itch, or inflame. Most people only notice when comparing pictures. A quiet but important alert. 9. Brittle nails with ridges and splitting. Nails tell stories. With hypothyroidism, they grow slowly, develop vertical ridges, and tend to split at the edges. Sometimes they partially lift from the nail bed, onycholysis, leaving a whitish area underneath. Moisturizers help temporarily, but lasting improvement only comes with hormone balance. 10. Constant cold and pale skin. Do you grab a sweater when everyone else is in t-shirts? Hands and feet like ice blocks? With a sluggish thyroid, heat production drops. The mirror shows pale skin, less rosy lips, and that endless search for thick socks even on mild days. 11. Unfair weight gain and rounder face. It's not just the scale, old photos reveal a slimmer face. Weight gain in hypothyroidism is usually modest but stubborn, a mix of edema and fat. The key is understanding that, with a slower thyroid, your body burns less, and that requires a tailored strategy, not blame. 12. Bloated belly from slow digestion. The gut also slows down, sluggish transit, dry stools, bloating. Visually, the abdomen becomes more prominent, especially by day's end. But simply adding fiber without water backfires. The secret is balance and consistent hydration. 13. Slowed speech, deeper voice, flat expression. Check old videos. Was your speech lighter, quicker, more melodic? Hypothyroidism can cause hoarseness and slow speech. Facial expressions lose vitality. Often, loved ones notice first: you seem so quiet lately. 14. Tingling fingers, try the 60-second test. Press the backs of your hands together and hold for 1 minute. If tingling shows up in the thumb, index, and middle finger, it may be carpal tunnel. In hypothyroidism, swelling around the median nerve narrows the space and triggers symptoms. The good news, treating the root cause reduces compression. 15. Droopy eyelid or crooked mouth that improves with treatment. Less common, but possible, temporary facial weakness due to nerve compression or infiltration. Rare, but it does happen and usually improves when thyroid function normalizes. Important, sudden facial droop is an emergency. Think stroke first and seek immediate help. 16. Orange-tinted palms, keratemia, palms and soles turning yellow-orange without jaundice? It may be keratin buildup. With a sluggish thyroid, your body converts less keratin into vitamin A. It's harmless and improves once you adjust high-keratin foods, carrots, pumpkin, and restore thyroid balance. 17. The extreme, myxedema crisis. Rare, but important, severe hypothyroidism can progress to confusion, deep drowsiness, hypothermia, and bradycardia. This is an ICU-level emergency. Recognizing it in time saves lives. How to use these signs to your advantage, not against you. The goal isn't to collect symptoms, but to organize evidence. Practical steps. 1. Grab a notebook, or your phone notes, and mark how many of these signs you recognize. 2. Write down when they started and if they worsen at certain times, cold weather, stress, postpartum. 3. Take this list to your appointment and ask for the basics, TSH and free T4, and depending on your case, T3, anti-DPO, ferritin, vitamin D, among others. 4. Take monthly photos of your skin, eyebrows, nails, and hair. Visual evolution helps more than memory. And avoid self-sabotage. I'm just lazy. Fatigue isn't laziness. When your thyroid slows down, your body is asking for adjustment, not blame. What to expect from treatment? When the thyroid truly underperforms, the gold standard is hormone replacement, usually levothyroxine, and optimizing absorption, taken on an empty stomach, away from coffee, calcium, and iron. Improvement isn't instant. Energy and mood often respond in weeks. Skin and digestion, 4 to 8 weeks. Hair and nails, months. Growth cycles are slow, patience is key. Meanwhile, natural measures help speed relief and prevent setbacks. Nutrition, hydration, sleep, stress management, and correcting micronutrient deficiencies. Natural strategies with scientific evidence to support thyroid health. First of all, these strategies do not replace medical care. What I bring here are natural resources, backed by research, that help improve well-being, energy, skin, hair, nails, digestion, and mood in people with a sluggish thyroid. These are safe measures to integrate into your daily life, always respecting your individuality. 1. Selenium, the thyroid's protective mineral function, cofactor of enzymes that convert T4 into T3, the active form of the hormone. Also reduces oxidative stress. Food sources, Brazil nuts, 1 nut can cover daily needs, fish, eggs. Evidence, systematic reviews show that selenium may reduce thyroid antibodies in Hashimoto's and improve thyroid function markers in some populations. 2. Iodine in the right amount function, essential for thyroid hormone synthesis. Natural sources, iodized table salt, seafood, seaweed in small amounts. Evidence, the World Health Organization has shown that salt iodization reduced goiter cases worldwide. But caution, too much iodine can also cause dysfunction. Balance is key. 3. Zinc and iron, indispensable cofactors. Zinc, involved in hormone synthesis and immunity. Sources, pumpkin seeds, beans, beef. Iron, necessary for the thyroid peroxidase enzyme, fundamental for hormone production. Sources, lentils, lean red meat, spinach. Evidence, deficiencies in these minerals are associated with worsened thyroid function. Correcting them improves symptoms such as fatigue and hair loss. 4. Vitamin D, B12, and magnesium. Vitamin D, often low in many people, correction is linked to better immunity and less fatigue. Vitamin B12 deficiency can mimic hypothyroidism symptoms, fatigue, tingling. Magnesium helps with muscle relaxation, digestion, and sleep. Evidence, observational studies link adequate levels to better quality of life in people with hypothyroidism and autoimmune conditions. 5. Anti-inflammatory diet base, fruits, a variety of vegetables, omega-3 rich fish, salmon, sardines, nuts, extra virgin olive oil. Reduce, ultra-processed foods, simple sugars, fried foods. Evidence, anti-inflammatory dietary patterns are associated with reduced fatigue, better weight control, and lower cardiovascular risk in people with thyroid disease. 6. Cooked cruciferous vegetables, safe and beneficial. Broccoli, cauliflower, cabbage, kale. In excess raw form, they may interfere with thyroid function, but when cooked they lose the goitrogenic effect and preserve protective antioxidants. Evidence: studies show that moderate, cooked consumption poses no risk for those with adequate iodine intake. 7. Fiber plus hydration for slow digestion. Daily target: 25 to 35 g of fiber. Sources: oats, ground flax seed, beans, fruits with skin. Important: always increase fiber along with water intake. Evidence: soluble fiber improves bowel transit and helps with blood sugar and cholesterol control, common concerns in people with sluggish thyroid. 8. Omega-3, natural anti-inflammatory. Sources: cold water fish, salmon, sardines, mackerel, flax seed, chia. Evidence: reviews indicate that regular omega-3 intake helps reduce inflammatory markers and may improve fatigue and cardiovascular health in people with thyroid disease. 9. Moderate and regular exercise: light to moderate aerobic, walking, cycling, swimming. Strength training helps preserve muscle mass, countering a slower metabolism. Evidence: studies show that regular physical activity improves lipid profile, reduces fatigue, and enhances quality of life in people with hypothyroidism. 10. Sleep and stress management. Good sleep regulates hormones like cortisol, which indirectly influence thyroid function. Simple techniques: consistent sleep routine, deep breathing, morning sunlight exposure. Evidence: research suggests that practices such as yoga and meditation can reduce fatigue and anxiety, and improve quality of life markers in autoimmune thyroid disease. 11. Practical meal plan example: 1 day, breakfast, omelette with spinach plus 1 slice of whole grain bread plus 1 kiwi. Lunch, mixed salad plus grilled fish, sardines, salmon, or tuna, plus brown rice plus steamed broccoli. Afternoon snack, plain yogurt plus 1 Brazil nut. Dinner, vegetable soup with quinoa plus drizzle of olive oil. This pattern ensures fiber, selenium, zinc, iron, and antioxidants naturally. 12. Keratin-mia, simple adjustment. If you notice orange-tinted skin on palms and soles, reduce carrots, sweet potatoes, and pumpkin for a few weeks. It is harmless and easily reversible. 13. Herbal medicine. Potential under study. Recent systematic reviews suggest that some medicinal plants may improve thyroid markers. But studies are still small and limited in quality. Always use with professional guidance. Realistic timeline. First month, more energy, more regular digestion, less sensitivity to cold. 2 to 3 months, more hydrated skin, less hair loss, stronger nails. 6 months onward, weight stabilization, improved mood and well-being. Now you have in your hands a natural, science-validated roadmap: key minerals, anti-inflammatory nutrition, fiber, sleep, movement, stress management, and simple daily adjustments. These measures do not cure hypothyroidism on their own, but they are powerful allies to relieve symptoms, speed recovery, and restore quality of life. Tell me in the comments, which of these strategies have you already tried, and which will you start today? Your experience may inspire and help others on this journey. Support our channel. Find out how in the first pinned comment below.